Type 2 diabetes is the most common form of diabetes. Millions of Americans have been diagnosed with it, and many more have it and don't even realize it. Dr. Mildady Murphy is here from Shelton State's Health and Wellness Center to tell us more. Dr. Murphy, thank you so much for being with us today.
Danny, you're absolutely right. 26 million Americans have it, and many, many more don't even know they have it.
That's like 1 in 10 people.
Exactly. And I think it may even be more than that right now. What we have found out as of now that, with medical guidance, nutrition, exercise, medication with type 2 diabetes can slow down the progression of this disease. But the inevitability is it may progress where you have to get on more of a routine type of medical intervention with needles, insulin, like that. But there's a very powerful study that has just been introduced by the National Institute of Health that shows that with negative energy, and it's related with nutrition, putting the body in negative energy balance. In the area of nutrition, they reverse the effect of the disease in 1 week.
Wow. In
1 week. Now, the study went for 8 weeks. And everybody was monitored very carefully by their blood sugar, their pancreas was monitored, their liver function was monitored, their cellular activity was monitored, and they took, the samples of their blood during that time between 1 and 8 weeks. And what they found with the strict dietary changes of 600 calories a day. Now, it's very strict.
600.
600 a day, medically supervised, that it reversed the effect of the disease in 1 week. And at the end of 8 weeks, liver function was normalized, pancreas function was normalized, as well as all blood sugar levels. And so that's a very powerful study to show an extreme case of nutritional changes, but it can be reversed by making those changes in the area of nutrition and working with your physician with exercise and maybe get off the medication in a short period of time.
Now, you mentioned negative energy. I don't know what that is. What is negative energy?
Well, in this case, it wasn't exercise. It was caloric intake.
Okay.
And so by putting the body in a negative deficit with calories.
Right. You're consuming more, or you're consuming less than you're using every day.
Absolutely.
Okay.
And by consuming only 600 calories a day, whether they were male or female. And I know it's extreme.
Yeah.
It really was. But it was medically supervised. There was no increase in physical activity or other type of energy expenditure. It was all in calories.
Right.
It reversed the disease process. So that implication is very powerful. If we start making, if you've been diagnosed with type 2 diabetes, smart dietary changes by working with your physician and a registered dietitian, you will not only slow down the progression of the disease, but reverse it.
Wow.
And that study underscores that point.
But that is going to be a very tough
It is tough.
600 calories.
Well, yes.
That is like some crackers and half a Big Mac.
Well, not that kind of a caloric intake.
Right.
It's medically supervised. But to reverse the effects of type 2 diabetes and to have that, to know that you don't have type 2 diabetes, it will motivate you to continue to do the right thing. So when after the 8 weeks, then you can get on a more balanced dietary approach.
Oh, so that's 8 weeks.
That's only 8 weeks.
Gotcha.
And then you learn how to make healthier food choices to keep the type 2 diabetes at bay.
There you go. And hey, if you don't have it, then you probably should think about doing some of those things anyway. Not the 8 weeks, 600 calories, but
eating healthy.
Because that's where it comes from.
That's right.
There's a link between obesity and type 2 diabetes and nutrition.
Absolutely.
And so
it's all linked.
There you are. It all starts with you are what you eat as a general rule.
I'm so proud of you, Danny.
I'm learning.
Yes,
I'm picking this stuff up. Not utilizing it, but I'm learning it. All
We're
right.
planting the seed, Danny.
We are. You can find out more about the Health and Wellness Center online at sheltonstate.edu or by calling 205-391-2994.